I think compensation's probably it. Speaking to like PT and MRI, I haven't had to use the data yet. It's only been like in conversation at board meetings that they've even thought about bringing on that type of, because the only ancillary we have is X-ray. But I appreciate having that data available in our survey, because when they want that data, they're going to want it yesterday. And so I need to make sure that, I have access to it, and then I'm reviewing it on occasion. And I think with our growth, it's mostly just been overhead, and we have too many people. Yeah. Which is at that point, what the reason it was so nice to have, okay, here's our standard number of employees for the number of providers we have, is because the idea that we had too many people on the physician side of the conversation initially had nothing to do with the data. It had everything to do with, we were in a space for 5 years that could handle 6 providers and all of the associated staff. We were all used to a lot of elbow room. And then once we got up and running to the place where he wanted, which was 6 providers, we didn't have as much elbow room. And so just not being able to move around, even mentally, to look at a space that you used to be able to spread out all your paperwork, and all of a sudden you couldn't. So to be able to use that, I don't know how to phrase it per se, but it wasn't
Chris,
a data-driven thing for
Chris,
him.
You mentioned looking at the square footage per provider as, like, well, we're a little tight now, but we're still fine relative to the rest of the world.
Yeah. And so it uses data it helps drive it takes the emotions out of decisions, is what we've said. So again, back to the employee thing, it was an emotional thing, feeling boxed in by all these people. And so to use data up against that and say, no, we're actually right, in line, and I think we're doing okay, helped, just bring that down and help him adapt to, okay, this is the new norm.